So first of all, you need a lot of centers. And second of all, there are just going to be a proportion of patients that are not willing to be randomized. We found that there were biases in terms of who physicians were willing to randomize, particularly as other DOAC studies were published. We found that some physicians had preferences for particular DOACs or had a kind of preconception about a particular antithrombotic strategy that they wanted to use that ended up with some patients being enrolled in the registry as opposed to the randomized trial. But beyond that, there are patients that either just aren't willing to be randomized. They don't want to leave things up to that uncertainty. And there is a proportion of patients that, are just not in the right headspace to participate in research at all. We had patients that didn't want to consent into either the trial or the registry just because, this is a traumatic event and they're overwhelmed and they're not feeling great. So one thing that we've learned is that, you may need to think about approaching that group of patients later on in their recovery journey as opposed to in the acute phase.